Welcome back, everyone. Today, we're diving into a really critical challenge in modern medicine. Just how do you manage the immense, complex resources of a hospital? We're going to look at how artificial intelligence is stepping in to help, and really how it's starting to transform everything from patient flow all the way to a physician's daily workload. So let's just start with a statistic that honestly gets right to the heart of the problem. For every single hour a physician spends with a patient, they're spending 2 hours on paperwork. Think about that for a second. This isn't just about some minor inefficiency. This is about a system that is actively pulling clinicians away from their number one purpose, caring for patients. And that's the massive challenge we're going to tackle today. All right, so to understand how we get from that big problem to the solution, we'll break our discussion down into these 6 key areas. We'll start by looking at the overloaded system itself, then we'll get into AI's core power, and then see how it's actually applied in both hospital operations and direct patient care, before we wrap up by looking at the crucial role that you are all going to play. So first things first, what does this overloaded system actually look like on the ground? Why is the need for a totally new approach so urgent right now? Well, it's really a two-front battle. On one side, you've got clinicians facing just intense levels of burnout from a mountain of administrative work. And on the other side, the hospital itself is struggling with all these operational bottlenecks. You see it in scheduling, in patient flow, in managing supplies, and all of it leads to delays in care. And these pressures, they don't just affect morale. They directly impact patient outcomes and, frankly, the financial health of our institutions. Okay, so how in the world does AI even begin to tackle such a complex, human-centric problem? Well, it all comes down to one core capability. It's power for pattern recognition on a massive, massive scale. At its very core, AI's power in medicine is its ability to see patterns at a scale that is just impossible for the human brain. It can analyze millions of data points all at once. I'm talking lab results, images, clinical notes, even staffing schedules, and find these really subtle correlations that would otherwise stay completely hidden. And this right here, this frames the relationship perfectly. The goal isn't replacement, it's all about augmentation. All right, so let's move from the concept to some concrete applications. And we'll start with the operational core of the hospital, the place where so many of those administrative burdens actually come from. So where is AI making a real, tangible difference? Well, it's being deployed across the hospital's entire administrative backbone. So instead of just reacting to a full ER, AI can analyze historical data, look at local flu trends, and actually predict bed demand days in advance. It can help create smarter nursing schedules to prevent burnout. It can optimize operating room usage to slash wait times. And it can even automate the supply chain so you don't have critical shortages. The whole goal is to shift the entire system from being constantly reactive to being intelligently proactive. And this is a brilliant real-world example. Operating rooms are incredibly expensive resources. So instead of building more, leading institutions like Cedars-Sinai and Stanford are using AI to analyze their schedules, find those little inefficiencies, and drastically reduce idle time. They're effectively increasing their surgical capacity using the resources they already have, which directly impacts patient access and, you guessed it, the hospital's bottom line. And these operational gains, they translate into significant financial benefits. Studies are showing that optimizing areas like staffing and inventory can reduce a hospital's operational costs by 15 to 20%. In an era of really tight budgets, these savings aren't just numbers on a spreadsheet. They are resources that can be plowed right back into patient care and innovation. Okay, so we've established AI can make the hospital run a lot more smoothly, but how does that operational efficiency translate to the clinical workflow? Let's take a look at how these tools are directly augmenting the clinician right there at the patient's bedside. This data here, it just powerfully illustrates the impact. Instead of a patient waiting over a week, 11 days, for a chest x-ray result because of a backlog, AI can help triage and prioritize, cutting that time to under 3 days. Or look at this, a routine pediatric assessment that took over 8 minutes now takes less than 1. This isn't just about speed, it's about crushing that diagnostic uncertainty and getting critical information to clinicians and patients much, much faster. And this speed, it can lead to proactive, life-saving interventions. For example, Kaiser Permanente uses an AI system that analyzes patient data to predict who is at a high risk of deteriorating, and fast. By alerting the care team hours before a patient might actually crash, this system is credited with preventing over 500 deaths every single year. It's just a crystal clear example of how predictive AI enables proactive care. And now let's bring it full circle, right back to that opening statistic about paperwork. One of the most promising applications is something called the ambient AI scribe. Basically, these tools listen to a patient encounter and automatically draft the clinical note. And as the study shows, the impact on burnout is immediate and it is significant, dropping by over 13 percentage points in just 1 month. This directly attacks a primary driver of burnout, giving physicians back precious time to focus on the patient, not the keyboard. Now, with all this talk of automation and speed, it is absolutely essential that we pause and discuss the limitations of these tools and, maybe more importantly, the irreplaceable role of the clinician. This is always the first question, right? And it's a really important one. But based on everything we see and how these tools are being designed and implemented, the answer is a clear no. The goal isn't to automate the physician out of the process, but to augment their abilities by handling all those data-intensive tasks, freeing them up for critical thinking and actual patient interaction. But we have to be really clear-eyed about the challenges here. AI models are trained on data, and if that data is incomplete or it's unrepresentative, the AI is going to inherit those biases and blind spots. A lot of these systems don't talk to each other, which creates data silos. And some of these models are what we call black boxes, making it hard to understand how they even reached a conclusion. And all of this, it points to the single most important factor, the absolute critical need for physician oversight. And this is the crucial takeaway, and it's just perfectly articulated here. AI is not an oracle delivering some absolute truth. It's a powerful but imperfect tool. And just like any tool, it requires a skilled and critical user. Your clinical judgment is the essential filter. Passive acceptance of an AI's output is simply not an option. Active oversight is mandatory. So let's wrap up by talking about what this all means for you. As you move through your training and into practice, what's your role going to be in this new AI-augmented clinical environment? Your job won't be to code the algorithms. It will be to lead their integration into patient care. So first, you have to understand the tools, what they're good at, and just as importantly, what they're not good at. Second, you have to be that final checkpoint, critically evaluating the AI's output with your clinical judgment. And third, you have to be a champion for responsible use, making sure that these powerful tools are implemented in a way that is fair and benefits every single patient. And, what we've talked about today, optimizing hospital resources, it's really just the beginning. These same AI principles are being applied to even more exciting frontiers, from accelerating the diagnosis of rare diseases to creating truly personalized medicine, which we'll get into in our next module. But this incredible potential brings with it an equally great responsibility. As we've seen, AI can optimize our hospitals and accelerate care, but it also presents new challenges and requires constant human oversight. And that really leaves us with the critical question for the future of medicine. Now that we see the benefits, how do we as clinicians manage the risks?